Welcome now to week 14 on policy implementation and evaluation. These are two stages in the policy process that often determine whether even the best designed policies ultimately succeed or fail. Implementation is where policies actually meet reality, and evaluation is where we determine whether they achieved their intended goals and why. These are the central competencies in public health policy work for today. So we'll explore the frameworks, barriers, and practical strategies that help ensure policy impact in real-world contexts. As always, by the end of today's session, you should be able to critically examine the barriers that commonly impede the implementation of new policies, whether these barriers originate at the level of individuals, healthcare professionals, organizations, or even larger systems. And we will also review the essential conditions for effective monitoring and evaluation, including what should be measured and why. The goal is to help you understand not only what should be evaluated, but also the logic behind selecting indicators and measuring progress. Let's begin with policy implementation, which is the stage where formal policy decisions are translated into operational action. Implementation is rarely straightforward because multiple actors, systems, and processes must align. Understanding implementation requires both conceptual clarity and practical insight into how health systems function on the ground. In assessing why policies succeed or fail, one of the first tasks is diagnostic analysis. This involves systematically identifying obstacles that might impede implementation. Some methods include brainstorming with stakeholders, conducting focus groups or individual interviews, and administering surveys that can help surface a broad range of issues, from practical constraints to deeper structural barriers. Diagnostic analysis is an essential precursor to designing effective implementation strategies. Barriers exist at multiple levels of the system. At the community and household level, limited demand or misconceptions may undermine policy uptake. Within service delivery, shortages of staff, equipment, or infrastructure can constrain implementation capacity. And at the policy and managerial level, poor regulation, fragmented governance, or reliance on donor funding can generate vulnerabilities. Cross-sector policies often face bureaucratic hurdles or weak communication systems, and ultimately, the broader environment, political, economic, and physical, shapes what is feasible. This multi-level framework helps ensure that implementation analyses do not focus too narrowly on any single component. Once your barriers are identified, the next step is to develop targeted strategies. For healthcare recipients, common barriers include program ineffectiveness, dissatisfaction with services, lack of proximity to care, denial or low risk perception, and cost of transportation. Interventions must respond directly to these constraints, improving program quality, enhancing evidence-based outcomes, and approaches, creating new services or redistributing service resources, delivering community education, or providing transportation support. This illustrates a basic principle of implementation science that strategies must be explicitly linked to the barriers they are intended to address. When we consider the role of healthcare professionals in policy implementation, we often encounter barriers related to knowledge, attitudes, and workload. A lack of knowledge may reflect insufficient dissemination of evidence or poor communication around policy goals, whereas disagreement with a policy, whether ideological or based on clinical judgment, can undermine implementation. And time constraints, especially in overstretched systems, pose practical barriers to adopting new protocols or tools. Interventions must directly address these issues, and enhancing information delivery through targeted education, training modules, or decision support tools can reduce knowledge gaps. Engaging respected opinion leaders to champion the policy can shift professional norms and increase buy-in. Finally, economic compensation or other incentives can offset the perceived or actual time burden associated with implementation. Some organizational level barriers often stem from culture, leadership, and structural limitations. Resistance or skepticism frequently emerges when staff do not see the value or feasibility of proposed changes. Weak communication channels can result in confusion or inconsistent implementation. Misalignment within the organization, including unclear roles or accountability, can slow progress, and interventions at this level require deliberate management strategies. Achieving small, early wins helps build credibility and demonstrate the benefits of change. A tailored communication plan can ensure that information flows to the right people at the right time. Establishing or strengthening management structures supports coordination and oversight. Moreover, leadership engagement is a critical predictor of successful implementation. Leaders must model support for the policy and allocate resources accordingly. Finally, robust monitoring systems ensure that positive results are both detected and sustained over time. When implementation requires changes at the system level, we move beyond individual and organizations to examine how care is delivered. Systems change involves rethinking fundamental questions. Who delivers care? Where do services take place? Which populations are targeted? What technologies support communication and information exchange? And how are quality and safety monitored? Each of these elements reflects structural determinants of implementation success. Effective systems redesign requires coordination across agencies, sectors, and providers, a complexity that emphasizes the importance of systems thinking in policy implementation. Financial arrangements form another critical dimension of systems change. Policies may require shifts in how resources are allocated, how funding flows, how providers are remunerated, but financial incentives can also be powerful tools for shaping behavior, only if they are aligned with policy goals and embedded within a sustainable financing model. Considering financing, funding streams, and remuneration structures is essential because financial misalignment is one of the most common reasons why well-designed policies fail during implementation. Finally, governance arrangements influence implementation through authority, accountability, and stakeholder participation. Policy authority determines who has the legal and regulatory power to enact and enforce changes. Professional authority shapes practice norms, while organizational authority determines internal decision making. Commercial authority, particularly relevant in mixed health systems, can affect market behaviors and the availability of services. Critically, consumers and stakeholder involvement ensure that policies remain responsive, legitimate, and socially acceptable. Effective implementation frequently requires adjustments across multiple governance domains to align incentives, responsibilities, and expectations. Now that we've explored policy implementation, let's turn to the second major theme for today, monitoring and evaluation. These processes are indispensable for understanding whether policy is being implemented as intended, whether it's performing adequately, and ultimately whether it is contributing to the outcomes it was designed to achieve. Monitoring and evaluation allow policymakers, funders, and practitioners to make informed decisions, adapt strategies, and ensure accountability. Monitoring involves a systematic and continuous collection of data that allows us to answer operational questions. Are activities being carried out? Are resources being used appropriately? Is the policy rollout progressing as planned? Performance monitoring, on the other hand, narrows the focus to assessing fidelity and efficiency, evaluating how well a program or policy is being implemented relative to expected results. This distinction is important because monitoring is not merely data collection, it's an intentional process that helps detect emerging problems, guide mid-course corrections, and ensure that implementation stays aligned with policy objectives. This flowchart provides a structured way to decide whether additional monitoring efforts are necessary. First, we ask whether a monitoring system is already in place. If yes, the next question is whether it captures the specific indicators relevant to the policy. If it does, no further action is needed. If not, we must assess the cost of adding new indicators, or if no system exists, the cost and feasibility of establishing one. This simple decision tree emphasizes that monitoring has opportunity costs, and policymakers must balance informational needs with available resources. Monitoring indicators typically reflect of a logic model structure of inputs, activities, outputs, outcomes, and impacts. Inputs capture the resources invested. Activities describe how those resources are deployed. Outputs measure the tangible products or services produced. Outcomes capture the short and medium term effects, such as changes in behavior or service utilization, whereas impacts reflect long term, often population level effects, either positive or negative, intended or unintended. This structured approach ensures that monitoring captures both the operational processes and their consequences. And not all indicators are equal in quality, as we know from uh, previous lectures. When selecting indicators, we assess several criteria. Again, validity. Does the indicator actually measure what it intends to measure? Acceptability. Is it relevant and meaningful to stakeholders? Feasibility. Can the data realistically be collected? And reliability. Will the measure produce consistent results under similar conditions? Then we have sensitivity to change. Can it detect changes attributable to the policy? And a new and predictive validity. Does it meaningfully predict important outcomes? Together, these criteria ensure that monitoring systems generate high quality, actionable information. This example from the UK demonstrates how a comprehensive monitoring and evaluation framework links intermediate outcomes, long-term outcomes, and national targets, or expected impacts. Each thematic area, such as maintaining HIV negative status, reducing undiagnosed infections, reducing transmissible virus, managing comorbidities, and improving quality of life, has clearly defined indicators and expected results. This framework also embeds equity by explicitly emphasizing inequality reduction. Such mapping clarifies how policy activities contribute to broader strategic goals, including the UN 2030 AIDS targets. Impact evaluation addresses a different question. Did the policy cause the observed change? It seeks to establish attribution, distinguishing between outcomes that happen due to the intervention and those that would have occurred anyway. This requires a counterfactual. What would have happened in the absence of the policy? Well-designed impact evaluations provide robust evidence on whether programs deliver value and should be sustained, expanded, or redesigned. Impact evaluation should not be undertaken reflexively. They are resource intensive and methodologically demanding. We ask, is performance evidence lacking or outdated? Is current evidence relevant to the local context? What are the costs of conducting versus not conducting an evaluation. We also must consider feasibility. Can we evaluate the program as it is being rolled out, or would it require changes? Finally, is impact evidence necessary to inform decisions about continuation, scale up, or termination? These questions help ensure that impact evaluations are conducted only when they can meaningfully guide policy decisions and not before or after. And then we have impact evaluations that rely on comparing individuals or groups exposed to the policy with those who are not exposed. The strongest design is a randomized controlled trial, which minimizes bias through random assignment. When randomization isn't possible, controlled before and after designs compare outcomes across settings with and without the intervention. Interrupted time series allows us to examine trends before, during, and after implementation, increasing confidence in causal attribution. Crucially, simple before-after comparisons without a control group can be misleading because they cannot distinguish intervention effects from other simultaneous influences. In addition to selecting an appropriate design, high-quality impact evaluation requires thoughtful planning because first, evaluations must be planned well in advance of program implementation to ensure baseline data are collected and that comparison groups are properly established. Second, evaluation design should be developed collaboratively with stakeholders, including policymakers, implementers, and community representatives, in order to ensure feasibility and relevance. Third, evaluators must estimate the number of individuals or sites needed for adequate statistical power. Cost-effectiveness considerations should also be included to determine what type of economic data need to be collected. Finally, pairing impact evaluation with process evaluation helps interpret findings by assessing how the program was delivered and whether implementation fidelity was achieved. Despite their importance, impact evaluation faces several constraints. The first is budget and time. Inadequate planning, insufficient duration of follow-up, or resource limitations can all compromise validity. Second, the quality of data often limits what evaluations can conclude. Missing baseline data, small sample sizes, weak comparison groups, or even failure to account for contextual influences all undermine causal inference. Third, political factors may constrain how evaluation results are interpreted, or even whether they are used. In some cases, independent evaluators may be required to ensure credibility and avoid suppression or distortion of findings. Recognizing these constraints allows us to design evaluations that are realistically robust and ethically sound. Thanks for your attention today, and we'll meet next session for poster development.